mental health may also like so much better than before. But of course, treating both would be ideal. For the feedback of the case two, let me see. Yes, I just posted this early morning around like 1 a.m. So uh, hope you can get a chance to take a look. So first, I would like go like over what I already written in the feedback because those are what you concern the most. So like first, the good news about the patient. The most recent scan shows that a lot of cancer has disappeared. And also, I start with a reflection of group 18. Like, it's important as practitioners that we listen to what the patient wants us to do for them versus what we think we can do for them. Of course, what we can do could be a lot, but what the patient wants us to do could be very limited. So this prevention and treatment of cancer with acupuncture and Chinese herbal medicine could be a huge topic. Or in a better wording could be supporting like symptoms, supporting patients, supporting symptoms of the cancer patients with Chinese medicine, Chinese herbal medicine, and acupuncture would be better. We are here more like support. So a few questions about this case you concern most. One is like some of you uh, may concern like I may use too many needles, and too many needles would be too draining for the patient. So we may consider point prescription as a herbal formula. Like for simple cases, less needles, like in the case for toothache. And for complicated cases, we need more needles to address, for example, like this case. So those ideas you can see from the Huangdi Neijing and also from a book named or entitled Clinical Interpretations of Commonly Used Acupuncture Points for, yeah, clinical interpretations of commonly used acupuncture points. That's in Chinese, sorry. And also, how does acupuncture work? So many research papers demonstrate the work where different systems and in different ways and in many details. But in general, the benign double direction regulating effect would be a brief sum up. So you can also refer to a publication by Professor Chen Hanping, a professor of Shanghai University of TCM, and also had been the president of, at that time still college, Shanghai College of Traditional Chinese Medicine for a while. So he has a paper like the most basic effect of acupuncture and moxibustion regulating the functions. So he also has a like monograph talking about the way of acupuncture. I really like that publication, but again, it's in like Chinese. So the second, what you concern most is like some said in the reflection part, like I was taught not to perform acupuncture around or near metastatic cancer. I think you may like to have the test. Let me get the test. Yes, it's here. Can you see my screen? Or I need to share my screen with you? Let me see. It's here. But I really like fascinated about your discussion. Like you have so good discussion. All right, thank you. Yes, here. So also like one in one group, some students said I was taught not to perform acupuncture around or near metastatic cancer. So I agree with you entirely. I wouldn't do it either. So in this case, the metastatic cancer on the abdomen is in the right lower abdomen. So where the patient showed me on her initial visit, it feel like a flat bump by touch, and it's quite far away from the renmai, from the conception vessel. So I chose points on the renmai not only based on the actions of those points, but also based on their locations. The renmai, those points, ren 4, 6, and 10, 8, 13, they are located along the fresh red scars from the surgeries. So needling along the fresh scar may help promote the healing. So that's another consideration. But I would also like to mention Professor Huang Jinchang, so the chief of the Department of Acupuncture for Tumors of the third hospital affiliated to Beijing University of Chinese Medicine. So he may needle the center of the tumor or circle needle the tumor and to control the growth of the tumor itself and all its metastasis. By the way, I think he's also a professor invited by Fabranches for the AOM program. You can see like here's his team. His name like 针灸微创肿瘤科. If literal translation might be 微创 means like minimum invasive treatment, but still acupuncture. So this, I think, minimum invasive acupuncture refers to acupuncture like needles the center of the tumor. They have another way is to like circle needling the tumor. Okay, so also if you are a Chinese, you can also check the CNKI. This team have a lot of publications, not just acupuncture, also herbs, like 196 something. But anyway, I go back, the wasting time to do so. But if you are Chinese, they're very easy to search publications from him and his team. And just like many ways of searching, like author's name, and then you can like further search acupuncture for tumors, like for example, but they have so many publications. Also, many people ask how the cancer is treated in China. So in China, cancer is managed through integrative care, I think from the very beginning. And also the good suggestion would be the earlier involvement, the better effects. So the third point, still on point selection. So it's like one comment is like we would have used more distal points and less local points on the abdomen in order to avoid creating an excess of the possibility of the cancer proliferation in her colon. So I also like distal points. I also like the combination of distal points with local points. And I do not know like why you say this, and also do you have any evidence to support? Again, also I encounter a lot of questions is like how to communicate with biomedical practitioners. So we have encountered this question from the very beginning. I teach this class. So the most important is you use the language they can understand. What language they can understand, that's the research papers. So second point, where I differ, so still from one of your comments, where I differ is solely in point selection as I practice more Japanese style acupuncture. For example, like I think she would focus the points around the tassel. So she also has a famous teacher like Soyashi Shimomura argues that the qi in cancer patients has put into the center of the organs. Sorry, I cannot see. Let me. Yeah, has put into the center of the body to preserve the vital organs. leaving less T in the extremities, rendering the distal acupoints less effective. So again, it would be very interesting to have more explanations. So I think your name might be Brittany Longworth. That's in my memory. So my memory is wrong, but if you are here, you are most welcome to share more explanations. So by the way, so when you communicate with practitioners, with biomedical practitioners, you would observe the strengths of the evidence. So the most powerful or the strongest the evidence is the systematic reviews or meta-analysis, because they group out the RCTs, the randomized controlled trials, like to evaluate, for example, whether acupuncture is effective for a certain condition. So the next level is the RCTs, randomized controlled trials. Then the next level is like non-randomized controlled trials. Then the next level is like case studies or case report. So the next, the bottom evidence level is the experts' opinions. So experts' opinions can be considered a kind of evidence. So the strength of the evidence depends on the expert's qualifications. Does he or she publish? How influential are his or her publications? Has he or she been invited to peer review his or her colleagues' work? And so on and so forth. So the next one is the general concern. I'm so worried about the possible effect of proliferation of facilitating metastasis with blood-moving herbs. So it's like, why not do some research? Why not do some certain research? So for example, Ezhu is a very strong blood-moving herb, but it also has very strong anti-cancer effects for so many kinds of cancer. You just need to go check PubMed. So I also encountered like a patient who has the breast cancer. So after like the surgery, she has been on tamoxifen, and she has so many side effects from the tamoxifen. And one of the side effects is the like no period for a year, but the endometrium is keeping thickening. So she is so worried about the endometrium cancer, but one suggests her to take some herbs to promote the period. She refused. She has refused my suggestion for a few months. So like she just came me for pain, for example, shoulder pain, or like mental problems like anxiety and so on. But finally, she decided for a try because I explained my proposal. I explained my herbs will not promote or has any possible effects of proliferation. I used, of course, Ezhu. Just a few days after, her period comes, and she's so happy. And also, her period comes regularly a month for several months until the lockdown in last March. Also, Honghua is a very famous blood-moving herb. The Xihonghua or Zhanghonghua. It also has very good anti-cancer effects. There are also published papers on that. And also, I think Dangui as well. So it's like, why not just worry? Why not go search and research, read some papers? So, I was formerly a professor of Shanghai University of Traditional Chinese Medicine. So in my university, we have also a school of Chinese pharmacology or Chinese materia medica. So they have professors who dedicated themselves to those chemical analysis of those single herbs, mostly single herbs, because they are much easier. Also, some publications on like compound formulas, even like from the former minister of the Ministry for Public Health, Chen Zhu. They also have a like paper published on formulas for blood cancer. So, and why not like read the papers? And also their papers all publish high-ranking journals like ICI Index. So, but also they will like beside of their like regular salaries, like annual bonus. So for any paper published in ICI Index journals, they will get like $1,500 like bonus. So this professor, I forgot his name. That year he published like over 20, like 22 like papers on ICI journals. Is like all on like chemical analysis of single herbs. No, I need to. So why not read the publications?
But I'm trying to.
You're gonna get feedback if you do that.
And I'm trying to log into Zoom.
And also like here, I want to share with you some proposals from your submissions. Like group 1 proposed Macedon's points for the patient, which would be also a very good idea. And also some proposed like joining a counselor support group, or seeing a psychotherapist, or adding more account points for emotional support, and thinking of end-of-life care. And so by the way, the patient is currently doing really well, and she's now again on like on chemotherapy, I think once in every 3 or 4 weeks. And so it's like this week she has no chemotherapy, so she traveled back to Florida to visit her parents. And like before, she traveled different places, LA or somewhere else, visit friends or sisters or whatever. So also, as for the formulas, some proposed 润肠丸补中益气汤 for the patient. And so besides, like when I was suggesting any herbs or any herbal formulas for the patient, and not just tell the patient the name, for example, the huangqi, I'm not just telling the patient the name, and send her like a few links about like most cited works on the modern research on the Huangqiang extractors. And she said, oh, I will forward this to her oncologist. So that's how I communicate with her oncologist. Also, like there are still lots of diet suggestions for the patient. Some propose more cold raw vegetables to help fill the bowels, to help with the constipation. And some proposed, less cold raw vegetables, less nuts, and like more warm bone broth and good protein for better nutrition. And so many contradictory, so many contradictory proposals. But again, why not do some research? Why not attend some, for example, CU classes to learn more? And that's the feedback are posted in the early morning. I think many of them may not get the chance to take a look. Now let's share with you the, let me see. The remaining questions and reflections. I will leave maybe 10 to 15 minutes or 5 minutes for you to raise questions. And so remaining questions. For the first case, as I said, what I can say is all covered in my written group feedback, because I didn't see the patient, and what I know about him, not more than you. So in the second case, yes, the prognosis of colon cancer is really very bad. And I think she was able to find relief from the side effects of her treatment. And like Actually, she comes somehow regularly, like more than just once a week. Like um, comes to see me almost once a week. So the first time is let me check. The first time I think is the April 13th. The second time is April 18th. So just 5 days. I did not include this note. So she chose the date she was on chemotherapy for this video taken. Then the third visit is April 27th. So were the treatment able to improve the quality of her life during treatment? I think obviously yes. The next question, would acupuncture help to shrink the tumor? If you consider the Professor Huang Jinchang's research, I would say yes. And also, by the way, so I have a sister who has the breast cancer with metastasis in the brain. So it's like from the prognosis from the top oncologists in China is like in half a year. So, but she had been fighting for this cancer for 11 years. And like top surgeons first to remove the brain tumor, then the second found also a little bit breast cancer, and the next they proposed to remove the ovaries and like a lot of surgeries. But in the meanwhile, she had been so well in taking the herbal formulas from a top expert in Beijing. I really forgot his name. I just remembered he is the classmate of Professor Wang Yongyan. Wang Yongyan, like he's really famous. And I accompanied her there, I think 2 or 3 times. We saw patients from all other parts of the country of China to see this expert. He already over 90 years old. And also along with this integrative care and like surgeries, chemo, radiation, and Chinese herbs, and like in fact, the tumor in the brain has always been shrinking. By the way, I also did moxibustion, but scarred moxibustion, not like just the warming up. If just warming up, I don't think it can really do something for the immunity. So, but scarred moxibustion is not allowed here in the US. And I think you may be sued because you intentionally like burn the patient and cause scars. So the next, the patient's history. The patient's history prior to her cancer diagnosis, especially diet. Yes, if in details, I still can ask so many questions from him. But also like nowadays, so many young people were diagnosed with cancer, even without family history of cancer. Like my sister, my family has no cancer history. But her cancer may be from like staying up too late in the night and also lack of sleep and also like barbecued food and I think like more like a lifestyle thing. So for the moment, so this patient only has an uncle with like colon cancer. So by the way, like I think lifestyle is really so important. Lifestyle and diet is really so important. And Professor Friedrich Warner, the founding father of constructive realism, a very famous philosophy of science. I think he's truly a friend of traditional Chinese medicine. And I also have been cooperating with him since 2007. And also he had a family history of cancer, like his parents, his brothers, and even his wife has no blood relationship with him, like, of course, but like, no matter what, all his family members died of colon cancer at a very young age. So he is very aware of that. So he has a regular colonoscopy done, and like everywhere, if I go with him to a Chinese restaurant, every time he ordered like broccoli. So I'm also wondering, so like for this patient, she has never heard of like broccoli is good vegetables for colon cancer patient. But anyway, I think lifestyle really important. So so far as for the emotional part, I think she's doing pretty well, and like no depression, no anxiety, like very calming, just like very weak, stressful on the like chemo days, on the days with chemo. So the SOAP notes, this question, how to put all of this knowledge into clear, concise SOAP notes that can be submitted to other medical practitioners and for medical claims. Yeah, that's a good question. So by the way, also noticed someone like with a question mark, stomach pain. So I really want to explain this because the patient, I cannot process her insurance. So the patient asked me to provide invoices for the treatment, then she can submit to her insurance by herself. So thinking of on her side, actually the fact is she only had stomach discomfort, not really pain. But I thought most of the insurance companies may like cover the pain related conditions. So then like I read stomach pain, but actually stomach discomfort. I think maybe from the chemo, from the nauseous, from also the constipation. So I didn't do that in the later notes, in the later like invoices. I just did what she really presented. But also she did present stomach discomfort, just not like so much pain, is the stomach discomfort. So yeah, for medical claims, generally my invoices are working for my patients. Like for example, my patient with the insurance, I think Anthem Blue Cross, and she got 70% of her payment back or reimbursed from the insurance company. You just need to provide the patient's information, the ICD-10 code and the CPT codes, and also your information. So like that's what I provided for my patients who asked for working with insurance companies. So yeah, clear, concise SOAP notes. I think you can just follow the instructions for SOAP notes and submit it to other medical practitioners. They will understand them according to their understanding of Chinese medicine and also their own check of the patient. So is it possible to think in team terms, but charting biomedical terminology, or do we have to perform separate intakes? You don't have to. You can just present in teamwork. So the next question, application of herbal medicine for cancer patients. So so here the problem is, I see like so many questions. My experiences here is like depending on the oncologist and also depending on the patient. If the patient is a strong-willed person, she or he can decide what she or he wants to like follow. And I encountered different patients like with cancer, and I gave them suggestions, also the links to the published papers. Like also have this patient, she told me like, my oncologist did not allow me to take any of you suggested herbal formulas. She said, if you do so, I won't treat you. So that's one case. But interestingly, because she came to see me because of the humeral fracture and for the pain and for the healing. So interestingly, because this like shoulder pain from this humeral fracture is bothering her so much. So also she cannot afford frequent acupuncture. So I suggest her to take the Sanqi, and also showed her the Sanqi like can promote the healing, also can reduce the pain. Also I show her like the brief description of the herb. The herb Sanqi has the anti-cancer or anti-neoplastic effect. So she decided to give it a try. So like that's an interesting like part. And also like when you are prescribing herbs for the cancer patient, you can just follow the theory of traditional Chinese medicine. And if you are worried about the possible proliferation effect from your herbal formula, you can check the single herb, especially the blood-moving herbs. That's the part you're worried most. Like I said, like 鹅竹, like 西红花, 藏红花, or dangui, those blood-moving herbs all have like very good like anti-cancer effects. So here, why Huangti is the only herb oncologist approved. If we are treating damp heat toxin, what would be the point of administering Huangti? So I think that's a good question. I think the oncologist may read the research papers on Huangti, see so many benefits of Huangti for like cancer patients who is undergoing the chemotherapy. That's why like she or he approved. And so still it's like, of course, the patient also has Qi deficiency, not just the damp heat toxin. So again here, how to communicate with the Western practitioners. So it's like, I think that's the question I frequently encountered. It's like, use the language they can understand. They do not understand language of Chinese medicine. What they understand is the evidence. Evidence published on top ranking journals and like PubMed index journals. So that's the language they can understand. So here the question is, how often the TCM clinicians communicated with the Western doctors, and if they communicate with each other during the full course of treatment. So I haven't communicated directly with the patient's oncologist, and that's a good question. But I also share or I sublease space from MD Dr. David Resnick-Senes. He has a very high reputation among the local people, and he always refers his patients to me. So I communicate with him. It's very easy. Just update how the patients he referred me are doing. And also, I may mention before, like last year, and maybe in March or April, he has the tinnitus and hearing loss from the nerve damage, and Western medicine cannot do anything. So I didn't go to the office to treat him with acupuncture. And I instructed him to do some brief self-needling with very tiny needles, and also where the FaceTime, at that time, where the FaceTime interview, I decided to order the Erlong Zuozi one for him. So at that time, I ordered 5 bottles. And not long after he tested me, and his hearing improved 30%, and tinnitus, I think, maybe gone. And then, like before the new year of 2021, he asked me for 2 more bottles of the Erlong Zuozi one. And not long ago, he updated with me how he's doing. Like he said, oh, now I just need to take the herbal tea once a week. So my condition is pretty good. So that's the last feedback from him not long ago. So he's very happy. But like he decides himself, like how frequent, how much he takes the herbal granules, not me. So that's the recent update, like once a week. So that's also a way of communicating with Western practitioners. It's like let them benefit from your treatment. So the next question is like, what's the next step for our profession in regards to integration? For example, many oncologists recommend not taking any supplements during the course of cancer treatment. Many cancer patients end up dying from the chemotherapy treatment because it weakens their body. Yes, to the point not being able to recover. In this situation, Chinese herbs could be extremely helpful to tonify qi and blood to help the patient regain strength. So I agree with you very much. As I said, the earlier involvement of Chinese herbal medicine and acupuncture, the better prognosis for the patient. But the problem is like what we can do versus what the patient allows us to do. Like there's a big gap. So like I also watched some interesting videos, YouTube videos actually, the oncologists in Hong Kong. So like at the very beginning, they were very doubtful about the effect of Chinese herbal medicine. But some of their patients just took the herbal medicine secretly. And then they finally found out that they really found like Chinese herbs are helping their patients in many ways. So these oncologists then like dive into those publications on like Chinese medicine for cancer patients. Like they study them, like they use them, or they refer the patients to practitioners of Chinese medicine. There's an interesting video I watched from YouTube. I think as for the next step for the integration is very much depends on the open-mindedness of the biomedical practitioners and also the oncologists, but on the other hand also on the research. So the biomedical practitioners, they believe the research, they believe the evidence, especially from the RCTs, the randomized controlled trials. They are considered the golden standard of evaluating a medical intervention is working or not. So the next question, why isn't every cancer treatment center promoting TCM as part of the treatment protocol? That's a very good question. With so much research and proven benefit, why is it not more widely utilized? How can we best approach oncology centers to encourage integrating a TCM practitioner into their cancer clinics to support cancer patients? How can we educate oncology doctors on the usefulness of both acupuncturists and Chinese herbs for this population? That's a very good question. So as I said, depending on the open-mindedness and also depend on how strong the evidence can present. Next, how the acupuncture provider will broach the herbal suggestions and benefits of Chinese herbs with oncologists. It does not seem like most oncologists are open to having patients on herbal medicine, and I do wonder when they recommend to start on these other treatments. Yeah, I think we can add this the next. Why are TCM practitioners not well integrated into cancer facilities and hospitals? I would love to know what it would take from conventional cancer specialists to choose an integration strategy. That's a very good question. So how is TCM care integrated into cancer treatment in other countries? In China is very much. Every cancer patient is managed via the integrative care. And also in my research team with Professor Friedrich Warner, we have a professor from University of West Virginia. She is an oncologist, and also she also advocated so much like acupuncture, Chinese herbal medicine for many conditions, not just cancer. So for this, where is dorsolateral prefrontal cortex point located and how to locate it? I may leave this question to Megan. Megan, if you are here, please raise your hand and let me know. Now it's already 1:50. So let me, our treatment principle. What's your, oh, Megan's here. Okay. I think, okay. I may stop here. Before I finish, let's see if I can see you. Yes. Before I finish my talk on cancer, as I said, it may need at least 50 hours to cover the topic. And but there are many publications on this topic. So when you have questions and do search and research, you will get more reliable answers on how to better handle cases, cancer patients, from nutrition to herbal formulas to acupuncture. Okay, so now I gave the time to Megan. So Megan, yeah.
Hi.
Hi. So Megan has been studying or has studied directly under this founding mother of Kiko style of acupuncture, right? Yes. So now we welcome Megan to give us a brief introduction to Kiko style acupuncture, like key points, like fundamental underlying mechanism, and also you may answer also this question, how to locate this point. All right, I give the time to Megan. Thank you, Megan.
Okay. I'll just make sure. I'm last minute in New York, so all I have is my iPad with me. So you just get me. I don't have any slides right now, but I can happy to give you a rundown and show kind of body points on myself. So thank you. I'm Megan Quesada. I am in the newest cohort, just started, so yay. I am a graduate of Tri-State College of Acupuncture. I graduated in 2016, and so we had extensive study both with Kiko's team, and then so 3 years with her team, and then within that 2 years directly under her, both clinic and in classes. So KM acupuncture, like most, like Japanese acupuncture in general, it's very palpation based. I'm probably saying a lot that everyone knows, but Japanese acupuncture in general, many of the practitioners were blind, and so palpation is how you treat the patient. And Master Nagano, who was Kiko Sensei's teacher, he was a blind acupuncturist. So she takes a lot from his style and has sort of has developed her own, very palpation based. So what we do, we use what are called reflexes. And I'm sure if there are questions, please let me know. Or if I'm saying stuff that you already know, let me know. So we take these reflexes and see if they're active. So if they are active, it will be a tight, tender point. It would be like a bruise. And then we check it against a different point on the body. And if the pressure on that point clears the pain in the reflex, then we needle that point we tested against. So I will give you kind of the three main root treatments. It's kind of the first three that we learn in school. And these three are diagnosed via the hara, so it's abdominal palpation. The first one is oketsu, which is it's stagnant blood, it's stuck blood. So we would feel approximately the left stomach 26, 27 area. It's not the points specifically, and you would feel for like a tight. It's usually tight. I would say probably 75% of my patients have it. And the patient will usually kind of protect or jump. And so when they have that reflex, the 2 points that we would use to treat that, the first one we would check would be left liver 4. So you would put your finger on liver 4, usually kind of directing it towards the point or towards the reflex, hold it for a little bit, and then you check the reflex again. And if the patient notices even a 30% reduction in pain, then sometimes I'll re-angle my finger, see if I can get more of a reduction in pain. And then you insert the needle at the exact angle that reduced that reflex. So it's left liver 4, and then left Japanese lung 5. And so Japanese lung 5 is traditional lung 5. It's between traditional lung 5 and traditional LI11, and it's kind of right there. And it's the same thing. You hold the point down, check it against the reflex. If pain has reduced, then you needle in the direction that reduced the pain. And for patients, it can be different on a different day. It could be more sideways, it could be more transverse, oblique, perpendicular. We're different every day. And so that's oketsu. I see that a lot. It's usually the first thing treated because we want to move blockages and sort of get everything started for the rest of the treatment. The treatment that I use, especially now in post-COVID world, current COVID world, is the adrenal reflux and the adrenal shock treatment. So that would be, so if this is your navel, so we're kind of in the kidney 16 area, and so you would palpate into the navel bilaterally, and if there's pain bilaterally, then that reflex is active. And the reason that's where the reflex is because when we're guarding, usually we suck that area in so it becomes tight. And the points that we would use to release those would be kidney 6 and kidney 27. And so it's the same thing. You start with kidney 6 and you see if it clears the reflex. And then if it does, you needle at that exact angle. And then same with kidney 27. If it clears the reflex anymore, you insert the needle at that angle that it cleared, and you repeat on the opposite side. this is not just used, we use it, we call it shock trauma. So, an accident, an assault, something, a jolt to the system, but it's also kind of that slow burn, adrenal fatigue, which we're all experiencing right now. So this treatment I use a lot. So again, palpate around kidney 16 heading towards the belly button, and kidney 6, kidney 27. Those are phenomenal points and usually knock my patients out pretty quick. The complement to that, or the option with that would be if kidney 2 is tender, so the fire point on the kidney channel, you would use the metal and water points to put out the fire. And so I always double check. If the person has the adrenal reflex, or even if they don't, I'll also check the kidney fire point. And you would needle, same thing, you would needle kidney 7, kidney 10 in the direction. You'd kind of play with your direction. And whatever direction that point reflex reduces, that's what you needle. So those really are the two, and also immune. So the immune reflex is the opposite of Oketsu. So it's on the right side, stomach 26, 27. And I know that the immune points were used in the first case study. So the immune points are in kind of that LI 10, 11 area. But what you want to, we were always taught, so, we would needle kind of going like this. I don't know if you can see this. The way you would needle the immune points, you kind of feel for like that tight gummy, that painful gummy area. And then that needle is actually heading kind of this way into the bone, like towards the bone here. So rather than into the arm, it's kind of a more shallow insertion. And that, again, I've been using a lot for the adrenal stuff because if the immune system's taxed, then you're also going to get a taxation of the adrenals. So those sometimes go hand in hand as well. As far as the dorsolateral prefrontal cortex goes, working with Kiko is very interesting because every year she comes up with a new point, or she gets excited about a new point. And so this one has been, I was in school when she introduced this point, so it was kind of exciting. So it's left-sided gallbladder channel. And so what you do, you kind of feel for depressions or you feel for gummies kind of in that area. And you take really thin, I usually use like the light green or the dark green ear-sized needles, and you just get them into that gummy area. Kiko, I believe she translated it as something like crazy in the brain as the treatment. But what I find this point to do is really calm patients who just can't get into their bodies, who are kind of just all over the place. They're not in their bodies. They're not kind of sinking into the treatment. And so it's a really, really great point, especially if you're using a very thin needle. There are so many patients that are sensitive in the scalp and don't like those needles, like scalp needles or head needles. These I find to be really effective because you use a really thin needle. So I hope I answered that question. If I didn't, please tell me. Working with Kiko in general, if anyone has the opportunity, take a class with her, but make sure that you do some reading beforehand because she talks very fast and she's so smart and can look at somebody and go, okay, this, and this. When we were in clinic, we would feel for the reflexes and we would use like surgical tape to put tape on the reflexes so we could look at the body and say, okay, this is what we see. And she would come into, through the curtain and look at the patient and tell us where we're doing our moxa and where we're doing, what we're needling and quiz us on this. And half of it was in Japanese. And so we would joke that she was, like Hurricane Kiko, but learning from her is amazing. And having that, what she taught us, I think, the most, and what I've gotten most out of treating patients in her style is that everyone's a puzzle. And we have all these clues in our body. And how do we put those puzzle pieces together? And I've had, especially, I know I keep saying this, especially lately, I work for a hospital and I treat a lot of the hospital employees, and they respond really well to this style because it is more gentle and it's a little more subtle, and sometimes they just need to be able to turn off that fight or flight response, and this can, especially the dorsolateral prefrontal cortex points, and especially the adrenal points. So I'm always looking, to throw in kidney 6, kidney 27, or kidney 7, kidney 10 on a patient, sometimes even if I don't feel it, or if they don't react to it and I feel it's still tight, I'll use it, especially if I know their history. That's another thing about Kiko style is that, as acupuncturists and East Asian medicine practitioners, we do, obviously take a very detailed history, but with Kiko, you dive so deep into a patient's history, basically to what their birth was like. If it was a traumatic birth, that can inform today's treatment. And so, unfortunately, in where I'm at right now in the hospital, I don't have the luxury of that time, but I do have the luxury of having patient access to the entire patient's chart from the hospital. So I can do that research on my own, but having that patient history and having patients think about it and say, come back the next week and say, you know what, I do remember, I was in a car accident when I was 5 and I, hit my head and my neck went this way. Like, okay, let's try this. So what we really learned, I think, was to be very curious and to look at each patient as a person, obviously, but also as a puzzle. And that's how I approach my my care. So I hope that was trying to talk about Kiko style acupuncture in 5 to 10 minutes is like trying to explain world history in
All right.
5 minutes.
Okay. Thank you, Megan, for sharing. Thank
Sure.
you so very much. And also, one last comment about different styles of acupuncture. So we are here still so fascinating about different styles of acupuncture because there's so many styles of acupuncture. And well, be aware what is going on in the research field because none of the research or any of the research is purely objective. So there's a famous acupuncture research, multi-centered and sponsored by insurance companies, a huge amount of money, and in Germany, then in 2000, I think in around 2000, maybe around, and because the insurance companies want to decide whether they keep paying the fees for acupuncture for pain conditions. So all these researches are 3-armed. It's real acupuncture group, sham acupuncture group, and also waiting list control or conventional care group. So they came out funny result is no matter real acupuncture or sham acupuncture were all significantly better than waiting list control or conventional care. But the problem is there is no significant difference in between the real acupuncture and sham acupuncture. So they have many publications, probably high-ranking like medical journals, and also they're like published their research papers published on JAMA. You know, JAMA, the impact factor of JAMA is very high. After their research, their randomized controlled trials, after their research, they conclude acupuncture is not effective for knee pain for people over 50 years old. So, you know, it's like, because we are in the profession, but most of the readers, they may just like read the results, right? And so how do we guard or defend our profession? So that's one thing. The other thing is make sure in your practice, what you deliver is the best possible treatment. And okay, as for the cancer, I think we still have so many things to to discuss, and we may really need so many hours, but maybe a brief on like nutrition. As for nutrition, I think really important, because from the very beginning, food as medicine and medicine can be food. So it's like I just talk about some contradictory parts. I think for the cancer patients, especially this patient, colon cancer with constipation, hi Jeremy, I think 80% fresh veggie juice, also nuts, grains are good. And because they are beneficial in converting the body type to the alkaline type. So yeah. I have so much to say, but maybe I have to stop. If you have any questions, I may give you a few minutes to raise some questions. I would like still answer some of your questions. Do you have more questions? No more. Okay. Okay. So yeah, just like keep doing good medicine. Here, good comment. Yeah. Make sure what you offer to the patient is a kind of best possible treatment from your knowledge and from your experiences. All right. So thank you so very much for today's class. And also thank you so very much for Jessie. So for Shanita's help. And thanks for everyone. You have a good, happy Father's Day. Thank you. Bye-bye.